Hello, my name is Dr. Lane Peterson, and I want to take a few moments to talk with you about my upcoming book, Dialectical Behavior Skills Training in Integrated Dual Disorder Treatment Settings. My book is really based upon some of the research that Dr. Linehan has done with DBTS, in other words, DBT for substance abuse. What I did was I took those research articles and the philosophy of DBT and DBTS, and I really set forth to, from beginning to end, explain the theoretical perspective and how it will drive what you do in teaching these skills to people who have co-occurring conditions. DBTS is an abstinence-based treatment, but also we recognize that people come in different states of readiness to change. And so the goal is to get the person to be abstinent by the end of treatment, but also knowing that they may have many co-occurring problems. We need to be mindful about what we treat when or what we prioritize when. The DBTS philosophy is also very compatible with a lot of the other approaches out there that are helpful for clients, including motivational interviewing techniques, relapse prevention techniques, and even some 12-step philosophies, including acceptance-based ideas, and making amends and doing those other sorts of things that can be helpful for someone who is in recovery. When I wrote the book, what I really wanted to do was redefine all of the different skills so that it was accessible for people who deal with dual disorders and struggle with these co-occurring conditions, not putting mental health or chemical health first or above the other, but really looking at integrating it for both. And so the skills are re-explained in those sorts of ways. I also wanted to, fitting with the spirit of integrated treatment, I also wanted to integrate other helpful elements like stages of change. Many people who work with people in recovery really value stages of change, and of course it's a trans-theoretical model that can be applied to any treatment approach, and it, in my opinion, was a very natural fit for this manual and helps people to understand where they're at in that change process. The major modules covered in this book have to do with mindfulness, have to do with distress tolerance skills to replace unhealthy coping, including alcohol and drug use, and the other unhealthy ways that people cope with symptoms of mental illness, emotion regulation, and interpersonal effectiveness. In addition, there are plenty of worksheets that are new and different to this book so that people can take the skills, apply them, and note where their symptom and urge levels are at prior to skill use and post-skill use, so people are able to connect what they do to seeing some benefit as they learn and as they use these different skills. Additionally, there are many plans in there for avoiding relapse, learning from relapse. When someone has a slip, I define that as skills learning improves progress, and we want people consistent with relapse prevention to learn from a setback so that they can be successful or more successful the next time. And in fact, stages of change research shows that successful change is almost always preceded by unsuccessful attempts. And general skills plans around safety, managing crisis, and of course maintaining health in general when someone reaches that stage of recovery. Like I said, the book will be coming out March 1st approximately of 2013, and if you work with people with co-occurring conditions, I hope you check it out. It will be a great resource for both treatment programs and also a great resource for individual providers who see people with these commonly co-occurring disorders in practice. Thank you.